Is your dog scratching nonstop, smelling sour, or developing thick, dark patches of skin? It might be a yeast infection, and it's more common than you'd think. I am Lyndall from Vetster, and today we're talking about how to prevent and treat yeast infections in dogs. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Right, let's get into it.
Yeast dermatitis is a common skin infection in dogs. It usually shows up secondarily to another underlying issue, like allergies. The result is itchy, inflamed, smelly skin. Treatment usually involves oral medication, topical treatments, medicated shampoos, and addressing whatever's triggering the overgrowth. Yeast are a type of fungi, and the most common one in dog skin infections is Malassezia pachydermatis. So you'll often hear a yeast skin infection called Malassezia dermatitis. Yeast organisms are actually part of your dog's normal, healthy skin ecosystem, but they're opportunists. When conditions are right, they can overgrow and cause infection. Yeast thrive in heat and humidity. Things that create that environment include skin folds caused by anatomy or obesity, matted hair, ill-fitting collars, harnesses or clothes left on too long, and diapers, especially if not changed frequently enough. Certain breeds and overweight dogs often have skin folds where heat and moisture get trapped. Matted fur and tight gear create the same warm, moist conditions underneath. The deep skin folds of a recessed or hooded vulva are also commonly affected by yeast dermatitis. While discolored fur, odor, and excessive licking are common with this kind of yeast infection, vaginal discharge is rarely caused by yeast in dogs. It's far more likely to be linked to a uterine infection called pyometra, which is an emergency. Other medical conditions can encourage yeast overgrowth too. These include environmental, contact, or food allergies, recurrent bacterial infections or antibiotic use, immune deficiency from various diseases or medications, excessive skin oil production, and endocrine disorders like Cushing's disease. Yeast skin infections are a common complication of canine allergic skin disease. Symptoms of a yeast infection may show up in just a spot or two, or affect most of the body. Typical signs include itchy, irritated skin, crusty skin lesions, foul odor from the skin, thickened skin, discoloration of the skin or hair loss, and lichenification. Lichenification is when severe, prolonged yeast dermatitis causes the hair to fall out and the skin to become gray, thick, and rough like elephant skin. Itchy skin is a prominent symptom in most dogs with yeast dermatitis. Dogs with allergies also commonly develop yeast otitis, which is a yeast infection of the ear. The skin lining the ear canal is warm and moist, just like skin folds, and that's a perfect environment for yeast overgrowth. Many skin conditions can look similar to yeast infections, so getting an accurate diagnosis from a vet before starting treatment matters. A vet usually starts with a thorough physical exam. Because yeast are opportunistic and only cause infection when something else is wrong, your vet will want a complete picture of your dog's overall health. Diagnostic tests can include skin samples examined under a microscope, called skin cytology, bacterial or fungal culture, blood tests, and skin biopsy. It's important to figure out if a skin infection is bacterial, fungal, or both, because the treatments are different. Antibiotics, for example, only work against certain bacteria, not against yeast. Once a yeast infection is confirmed, the treatment plan may include topical or oral antifungal medication, medicated shampoo, and treating other underlying conditions. Surgery may be necessary in some cases to correct anatomical problems that contribute to yeast infections, like a hooded vulva or excessive skin folds. Weight loss may be recommended if those skin folds are caused by obesity. Your vet may also suggest changes to environmental factors that contribute to infection. Yeast infections sometimes recur. That happens when the underlying cause wasn't effectively treated or managed, or when medication wasn't given correctly or in the right dose. Always finish the entire course of medication, even if symptoms go away quickly. The best way to prevent yeast skin infections is to manage contributing health issues like allergies. Other prevention steps include cleaning between folds of skin, keeping the skin dry and cool, preventing obesity, and selective breeding. Some breeds are genetically at higher risk of yeast infections. That includes multiple terrier breeds, basset hounds, cocker spaniels, Maltese, Chihuahuas, poodles, dachshunds, and Lhasa Apsos. Dogs with face or body skin folds may need regular cleaning between the folds to prevent moisture buildup, especially pugs, Shar-Peis, French and English bulldogs, bloodhounds, and Pekingese. You can talk to a vet or professional groomer about how to care for your dog's skin based on their genetic or anatomical risk. A virtual vet appointment is a great way for a veterinary professional to give step-by-step instructions on caring for your dog's skin. If your dog is showing common signs of a yeast skin infection, like itchiness or visible skin changes, talk to a vet. Don't try to treat your dog's skin issue at home without consulting a vet. Attempting home treatment delays proper care and may do more harm than good. And recurring infections are likely if the underlying issue isn't addressed. And if you need a convenient way to get expert advice from home, book a virtual appointment with Vetster. Thanks for watching, and we'll see you in the next video.